This presentation concerns development of void diary, specifically for screening and clinical care monitoring. My name is Dr. Schmidt, and I have no disclosures. We'll start the presentation with this stat. There are roughly 200 million women with incontinence in the world. This number is not going down. It begs the question, is there some way to preempt this recurring problem? Rules of behavior affect all muscle systems. This concept is well accepted, especially in sports, as is illustrated with this picture. The bowel, bladder, and pelvic floor are no different. Inefficiencies in toileting behavior can have long-term consequences. There's good data to suggest that many children enter their teens as holders or with degrees of bladder overactivity. There's no long-term information to know what transpires with respect to the lower urinary tracts of these kids as they travel through life. A void diary can be extremely useful in early identification, diagnosis, and management of lower urinary tract dysfunction. Chronic dysfunctional toileting habits could accelerate the neuromuscular decline that may very well be part of normal aging. Void diaries could be used to screen for those people at risk for lower urinary tract clinical consequence with time. Early intervention logically would obviate the degree of an evolving failure in the lower urinary tract integrity. Age-old paper diaries are the norm. However, advances in technology allow computers to replace paper diaries, both for recording, more in-depth analysis, and interpretive algorithms. The void diary is launched from a website. Data entry via trained caregiver versus a patient is selected from a drop-down menu. One format is simpler than the other. Void entries from a separate window are organized in table format. Note the 8-hour time frames for the diary: overnight, active day, and evening. A list of previous diaries parallels the present diary. Flags are used to note applied therapies associated with particular diaries. Diary analysis is formulated in both table and graphic formats. Normal targets are added to most of the graphs. This is a table summary of traditional diary data. Example, frequency, void volumes, and deviation score data is provided. There are 4 options for graphic analysis: line, bar, 3D, and overlapping or stacked graphs. This is a bar graph example of a patient with a low volume output over 24 hours. Note the disproportionate urine output overnight, suggesting third spacing of fluid. The yellow line represents normal targets. This graph shows a patient's actual void frequency and a conversion to a standardized 2000 cc volume. This standardization is needed to separate physiologic from a pathologic void behavior. This is a bar graph of void volume distribution. Voids are categorized into 100 cc allotments. Hash bars are considered less than ideal. Solid bars are considered ideal. The following steps are needed to create a stacked graph. First, comparison dates are selected from the display menu. Then, the type of graph, which graph to export, and the export format. This is a stacked line graph comparing deviation scores of 2 diary results. This example notes benefit with treatment. The blue line is baseline deviation scores. The red line is post-anticholinergic treatment deviations. This bar graph compares void frequencies from an Interstim trial. The gray and blue bars are baseline frequencies. The red bar are frequencies during the Interstim trial. Note the marked frequency reduction during the Interstim trial. That is the red bars. This is an Interstim trial summarizing void volumes in 3D graphic format. Blue and gray bars note treatment volumes are all less than 100 cc's. The red bar, void volumes with Interstim, are all greater than 400 cc's. Quite a dramatic difference. There's an option for a patient to do their own private diary. It's a much simpler format and it's available as a mobile app. On opening the program, there's a choice menu of buttons to choose: start a diary, results of the most recent diary, log of previous diaries, and guideline info about the diary. On choosing start log, a void entry window appears for each void. Time and volume are entered. Entries are then logged in list format, somewhat similar to the doctor diary shown previously. On completing the 24-hour diary, the patient selects results from the menu page. A basic analysis of diary findings is displayed, as well as reference targets for immediate perspective to the patient. The patient can optionally choose to forward the results to a care provider. A void diary is a well-suited tool to screen and monitor for voiding disorders. I hope in particular that this presentation will stir interest in evolving screening programs that will allow a more preemptive approach to the management of lower urinary tract disorders. Thank you very much.